I'm Karen Gansevoort, and it's really a privilege to be here to talk with you today. Great presenters so far. So I'm here to talk about the trauma-informed visit. I'm a nurse and women's health nurse practitioner. I've worked at Planned Parenthood of Western Northern Michigan for 15 years, first as an RN for the first 5, and then the rest of the time as an NP. I used to travel up to White Cloud once a week, right across the street from where you are in the health department there. We used to have a clinic that closed due to funding, of course. And I'm also a SANE, or sexual assault nurse examiner, and I've worked for the nurse examiner program at the YWCA of West and Central Michigan in Grand Rapids for 5 years. So I do, I work on call and do forensic exams for victims of acute sexual assault for them. But otherwise, I'm full-time, a full-time MP at Planned Parenthood. And again, I want to thank you all for being here today, especially on this first beautiful Friday that we've had in a long time. Just the fact that you're here says you've chosen professions where you care about people, you care about your community, and that's a big deal. So you all deserve a pat on the back. And I need to reference this quote. It's from a band called Star Sailor. It's just a pop song that I like. Thank goodness for the good souls that make life better, because you do. So that's you. What is a trauma-informed visit or exam? It means being cognizant and aware that the patients that you take care of might have a background that includes trauma or abuse, and I think we've covered that well today. And it's important to know that this has implications on how our patients might respond in a healthcare setting, and that we need to tailor our approach in order to do our best for our patients. And it's kind of funny that when I was invited to do this talk, and I went to talk to my mentors about what I was going to do, and they were like, "That's awesome. What is that?" And it's like, I learned this from you. And so I think it's what we've been doing for a long time, but there's new language to describe it. And we're learning from other disciplines like social work and psychology. And I'm glad today too that there's a lot of different disciplines here sharing this information, because it's so important. And like the program that I went for nurse practitioner training was very centered around holism and meeting the patient where she is in her life and empowering her to be the healthiest person, and encourage her well-being as much as possible, and being non-judgmental. So this is stuff that we've been doing for a long time, and I'm sure you've been doing for a long time, but there's just kind of a new way to frame it and a new language for it. So, and I think what we're going to talk about is widely applicable too, so not only to patients who have experienced sexual trauma or abuse or different kinds of trauma, but and I know this today's discussion focuses on the perinatal patient, but I think this information is widely applicable. Just to review, lots of stats today, but this is just really basic stuff. Each year there are over 200,000 victims of sexual assault in the United States, and 1 out of every 6 women have been victims of either completed or attempted rape in her lifetime. And unfortunately, being a victim of rape or sexual assault increases the chance that somebody's going to be re-victimized. And looking a little bit closer at the statistics, just at the ages of when people. And again, victims are usually women, so I'm going to usually talk about her, she, and of course we know that men can be victims too, but usually we're talking about women. 44% of victims are under the age of 18, 80% are under 30. And then if you look at childbearing age for women, the 3 decades of childbearing, roughly from mid-teens to mid-40s, average age of first pregnancy is 25. So you can see the overlapping nature of these populations. So what's the implication for that? Well, obviously, and I know this is not new for you all in here, but if you're caring for a woman of childbearing, for women of childbearing age, it's a given that some of your patients or clients are going to be survivors of sexual assault, and some of them may have already been assaulted more than once in their lifetime. And I use the word survivors or victims, or most of the time in my line of work I'm referring to patients, so a lot of times this terminology is used interchangeably. ACOG guidelines, or the American College of OBGYNs, recommends that every women's healthcare provider screens their patients at every visit for a history of sexual assault. And that's just that specific trauma. As we can see, there's many more things that can be traumatizing and lead to disorders like PTSD. But if you're working with women, your facility should have policies in place to address this. But that said, you may or may not know that the person that you're seeing has a history of sexual trauma or other trauma, because the patient may have chosen not to disclose. But that said, I think this information can be helpful even if you don't know that they have a history of trauma or abuse, or even if they don't have a history of trauma or abuse. It's just, the awareness is what's important. Obviously, our experiences shape who we are, and traumatic experiences can impact of how a person responds when they come into your healthcare setting. Sexual trauma, of course, is going to be a huge one, but also bad experiences with another healthcare provider. I don't know, well, probably lots of you may have had somebody say, or I don't know how many of you actually work in a healthcare setting, but I'm really nervous to be here today because I had a really bad experience someplace else, be it a painful exam, or they felt like they weren't being listened to, or they felt judged. So a lot of times people come in already with this baggage that they got someplace else. Previous pregnancy loss or pregnancy complications, especially in the perinatal setting, they can be fearful because they've had a bad experience, or they're going in for their for their prenatal visit, and they're really nervous because they went through a time when they didn't hear that heartbeat. Other considerations, obviously, fear of the unknown, being scared because there's something wrong, and they want to know what's going on with their health.